All right. Hello, everybody. Welcome to our session tonight. Today, we'll be listening to Dr. Anthony Nguyen about his journey and what he does every day as a general dentist, specializing with cosmetic dentistry as well. All right, you could take it from here.
All right. Hi, everybody. How's it going? I'm Dr. Nguyen. I grew up in, so let me actually start my screen thing here. Okay, share screen. Make sure I don't mess this up. All right. See that all right?
Yes.
Okay, so bigger. Perfect. All right, so I'm a general dentist in Redondo Beach, California. I grew up in LA. You can follow me at Dr. Sabatooth down there. And thank you guys for hosting me. These are just some of my memberships that I hold on to right now. But a little bit about myself. I'm the owner and clinical director of Art to Dental. I practice here Monday through Thursday and some half days on Saturdays. And also I'm a part-time faculty at UCLA School of Dentistry. And today's topic will kind of go over a bunch of stuff, a little bit about myself, the education I had, the pathways that got me to this place right now, a little bit about general dentistry, cosmetic dentistry, and a typical day in the office, and some advice for you pre-dents out there. I didn't graduate, well, I graduated not too long ago. I feel like it was like 5-6 years ago from dental school. So I don't feel like I'm too far removed from you guys. But a little bit about myself. That's my wife there on the left side. I've known her since the 3rd grade. So she's my childhood crush. So it's been a long time. I play bass in a hardcore band. So, and I love coffee. So that's one of my past students. That's Ellie. She brings me coffee to work. So if you guys need anything, just bring me coffee. Okay, so why dentistry? So for me, let me move this a little bit. I always wanted to, well, I didn't know that I wanted to be a dentist at first when I was growing up. I knew I wanted to do something in medicine because I just loved helping people and I loved science. I just didn't know what kind of avenue to get myself into. So I thought about med school, dental school, and then somehow along the way, I met a really cool dentist. His name's actually Dr. Nguyen also. He was my dentist when I was growing up. Super young dude. So I really connected and hit it off with him. And so one day I was like, hey, do you mind if I come shadow you? And the rest is history. So I was able to shadow him. I did a little bit of sterilization for him, chairside assisting for him. And then eventually I kind of was like, okay, this might be something I'm actually good at and that I'd want to do. And then later on, I kind of got into undergrad, and we'll go through about my education later on. But through undergrad, I kept in touch with him. And then I just found out that I really, really enjoyed dentistry. Much about it that I liked is that I loved the medicine. So it was kind of like a mix between medicine and kind of working with my hands at the same time. I loved the impact factor, which to me meant that I could directly help people, get them out of pain, or now indirectly by teaching students so that they can help other people. So that really brings me great joy, and it really makes teaching and doing dentistry worthwhile for me. Like, what better career than to help people every day? Like I said before, I like working with my hands. I love doing surgery, so that's one part of my practice, which I do a lot of. And I love connecting with people. So thank you for giving me the opportunity to talk to you guys.
And
this is a little picture. Yeah, you had a question?
A quick question about your teaching. So to get into that, did you have to like get a separate degree, or if I wanted to teach in the future, is there extra steps that I need to take beforehand to do that, or?
Great question. I don't think you need to have a separate degree. Well, I don't have a separate teaching degree. I've been in practice for about 6 years now. And during the beginning of the pandemic, a lot of the faculty at UCLA were kind of leaving. So I reached out and I was like, hey, if you need help, I'm more than happy to help out. And I went to my residency at UCLA, and that gave me a kind of like an in already. And it was kind of going through the vetting process, and here I am today.
Oh, wow. Okay. I didn't know it could be that simple.
It is that simple. Like, if you enjoy it, I think there's a need for academia out there. Like, there's not a lot of, at least young dentists that are teaching. So there's like a disconnect between what's practiced now and like the old school way of dentistry, which a lot, I mean, it's still relevant, but I feel like there's better ways.
I understand. And then does that affect your schedule in any way? Or?
Not really. I give only one Friday a week. And so I think it's a good balance because for me, like teaching is more of a way to get out there and kind of connect with your peers and your colleagues. Dentistry is very lonely at the top because you're like the top dog at your office, and then everybody else kind of works around you, and you have to have this certain level of leadership, and you can't have that with you. There's a different level of connection with your colleagues that you kind of understand that same thing.
I see. Okay. Thank you for that.
Yeah. Big segue. Keep asking these questions. I love it. Okay, let's see. Okay, so a little bit of my education. I went to undergrad at Cal State Long Beach. That's over here in California. And I transferred to Adelphi University, which is in Long Island, New York. I did not get in my first round of dental school. So anybody that applied and didn't get in, don't feel discouraged. I got in my second round at Detroit Mercy and then did 4 years there. After that, I completed my general practice residency at UCLA. So let's see. So a little bit about Adelphi. So you guys are probably an undergrad right now, so this will probably be super relevant to you. I majored in biology. You don't have to major in biology. A lot of my classmates did, biochem or chem or engineering. I had a couple of engineers in my class. So it can be anything really. But the biomedical sciences really help you get really used to the dental school stuff because it's mostly the same things, but just kind of more advanced in more detail. Yeah, you're going to be good. Yeah, so I did not minor in anything. I did not do any post-bachelor stuff. So a tip for you guys is if your GPA is kind of low, definitely do a post-bac to kind of increase that GPA because it's very important for getting admissions. The DET is also very important. And these are some of the things that you'll probably have to do along the way right now to get into the dental school. And shadowing and experience is like one of the big things too. And for me, they told me, well, when I asked the dental school, like, hey, why wasn't I considered for getting in this first round? And so they told me that I needed more experience and I needed to up my DET score. So that's what I did. So 1 year after undergrad, I worked for an oral surgeon as a surgical assistant, anesthesia assistant for a year. And then I reapplied, had a better DAT score, 23, and got in at that point.
So. And then when you were looking for these extra shadowing experience and externships, was it particularly hard for you, or did you have any resources that helped?
Great question. So I don't feel like it was particularly hard. I think right now there's a shortage in dental assistants in general. And so if you're willing to offer free help, you're like, hey, I'd love to come in, just help you out. You don't have to pay me. I just want to learn. And, I think most dentists will be like, heck yeah, come on in.
Totally.
And that's how I started with both of these jobs. I was the sterile tech because I just wanted to shadow. Like, hey, let me just help out. I just want to be around you guys so I can kind of get information and have maybe things absorbed to me, But I think that's going to be really straightforward and easy. I think just shadowing in general will be hard because you just don't want somebody auxiliary just looking around your shoulder. That's more risk, especially during COVID. If you're actually helping out, I think that's a win-win for both.
All right, useful tip.
I hope that works out for you. Yeah, I mean, it's a little bit more difficult these days for COVID, but I think that will be very helpful for most dentists out there to have an assistant that will be like, hey, I'm just here to help, Okay. So in undergrad, you're going to do your applications, you're going to go through your interview process. And then if you're lucky to get multiple offers, then you just got to pick which one's either more aligned to what you want. And it's kind of hard in the very beginning because you're not exposed to everything in dentistry. So it's kind of hard to be like, okay, well, I want to specialize in this or specialize in that. But if you have that, that foreshadowing of like, oh, I want to do that, then you can pick a school that generates more of those kinds of dentists. Like certain schools will be known to be feeder schools for specialties. So.
I understand. Okay.
Okay, and then so in undergrad, make sure to be close to your teachers, especially the ones that can help you out, because they can write these letter of recommendations for you, and they'll be very powerful because the admission committees really look at that stuff. Okay. Questions?
I did have a question. So I know that some dental schools request letter of recommendations from dentists too that you've shadowed and stuff. How did you approach them for that? Or was it just an easy like, oh, can you write this for me? Or
I think for me, it was pretty straightforward because I worked for the dentist for like a year, and the other dentist, I've been friends with him for a number of years because he was my childhood dentist. So I mean, it was just very natural. But hey, do you mind writing they're super excited to write it for me. So I was very fortunate about that. Bless, yeah. but I think these connections are important because these will be your colleagues later on. So yeah. Okay. So after being in a 1-year hiatus, working and stuff like that, gaining experience, I got into dental school. Detroit Mercy is where I went, which is in Detroit. If you guys are familiar with that area, it was pretty run down at the time, but it's really, really awesome right now. I always tell people there's a Lululemon downtown now. So.
Yeah, you just
come up a lot. In dental school, you learn about advanced health sciences, like I was telling you guys, like biochem, stuff like that, anatomy, pharmacology, stuff you would probably learn a little bit or had a little bit of, you touched on it in undergrad. So it's just adding more to that. So you really build on these things. And during dental school, I think it's, at least for me, was more straightforward because I really wanted to learn about these things. And it didn't feel like a chore as if I were in undergrad, you know. But in dental school, it's 4 years. The first 2 years are mostly didactic. The second 2, you're in clinical clinics and you're doing the crown preps, the normal fillings, the dentures, what we call bread and butter dentistry, just the normal dentistry that everybody needs. And then you talk about and think about going to specialization around the 3rd and 4th year, if you have the grades for it. And then you go through this thing called the pass match process, where you match or you rank the specialty program and they rank you after the interview, and then you match together. But during dental school, you do your boards and your exams, and like I said again, apply to residencies and licensures and stuff like that. But this was my dental school class, so this was, I think, one of our last days of school. So we're a super tight knit group.
Oh, really quickly before you move on.
Yeah.
So, did you think? I haven't really heard too much about this school, so I'm kind of interested in what you thought was like. What was a good part of that about this school, or what was something that you wish they could work on?
Sure. I think Detroit Mercy is not a very a research-based school, which means that they breed really, really competent clinicians. I always compare my dental school with my surgical skills, because during dental school, I must have extracted over 200 teeth. And yeah, and I'm not even like exaggerating at that point. I know some other dental schools in California, at least, you might extract 4 before graduating, you know.
That's insane.
That's a huge difference in, you know, in what dental schools offer. And I can only speak for what I've seen, but I can tell you now that at least Detroit Mercy at the time gave me really good clinical skills, not only in surgery, but restorative dentistry, and making sure to hone my hand skills at that point too.
And then what made you want to decide on Detroit Mercy? Was it because of the whole clinical aspects of the curriculum?
No, it was the only school I got in.
I see.
Yeah, I mean, I was waitlisted at Tufts. I was waitlisted in Indiana. And then as soon as Detroit like accepted me, I was like, okay, I'm going there. I'm just, you know, you just got to get into a school, and you're hear from other dentists. Just go to the cheapest school. It's going to be all the same. You're going to have opportunities to, you know, do CE courses and stuff, which stands for continuing education after the fact. Most dentists, at least in California, will need at least 50 hours of continuing education every 2 years to maintain and be in good standing with their license. So it's a continual process, and you'll always learn. and I'm always learning, and I'm still learning. And I mean, I think it just gets you competent, and then at that point, it's all up to you to decide what you want to do after.
That's true. Okay. And then what made you not want to choose a specialization, or was there anything you were leaning towards where you're like, oh, I can't?
Yeah, actually, I was really torn because I thought I wanted to do oral surgery.
Mhm.
Then I thought, I was like, oh, that's 4 to 6 years of school. I didn't want to do that. I was like, okay, maybe I'll do perio. That's only 2 years, you know.
Mhm.
And I was like, but I'm kind of over it, and I just want to go out and practice. But I still didn't feel confident enough. I was like, I still want to do a lot of surgeries. So I said, okay, maybe I'll do a GPR. And so that's kind of what I applied to. GPR stands for General Practice Residency, if you didn't know. So it's a year after, it's an optional residencies for general dentists. So there are 2 types of them. One is that, and is an AGD, which stands for Advanced Education in General Dentistry. And every program has its plus and minuses. And I chose the GPR program, specifically the UCLA one, because it was very heavily focused on medically compromised and complex patients. And I felt like at the time, if I wanted to do surgery, I needed to understand medicine and be that bridge between dentistry and medicine, so that I would not be afraid of my patients when I did surgery.
I totally
afraid
understand.
as in medically afraid of them, like, oh, what if they and stuff like that, you know. And so I did a couple same thing with going into dental school. I did some shadowing. I went to multiple programs to take a look at them and see what it was all about. And you know, UCLA ranked #1 by far. And I was like, if I'm not going here, I'm not going anywhere else. I'll go to practice.
That was the one and only. Okay.
So, yeah, so then I got in, and that's that. So this was us and my group of residents, co-residents. My first day of residency and the last day. We're really tight-knit group. Some of them are actually specialists now. So so some people use the GPR or AGD as a stepping stone to advance their skills and then reapply to residency if you didn't get in the first round.
I see. I didn't know that. Okay.
So nice. Oh, good. At least I can teach you something there. But yeah, so the pass match, like I was telling you before, you rank the program, they rank you. In this program, we learned advanced techniques in surgery, prosthodontics, sedation, and anesthesia. And then a lot of people get to make a decision if they're going to want to specialize. And at that time, I was like, do I want to specialize again? And I kind of went through that process. And finally, the decision was, no, I'll work. And then if I decide I want to go back and I'm not loving it, then I'll go back.
That's true. Yeah. You could always switch it.
Yeah, I mean, you know, when you get out, you feel like you want to learn more and get into it because all your colleagues at that time, you're in that little bubble and they're either gung-hoing specializing or they're gung-hoing practicing. But, you know, once you get out there, you'll feel like there are a lot of people in between where like, oh, you know, they'll practice for a number of years and they go back to endodontic residency, or then they go to orthodontic residency. So it's not like it's not like finite. You can change up if you want to.
I get you. And then for the residency program, oh yeah, right. This was the only one you wanted to go to. But did any of your friends or anything have a huge problem? Not problem, difficulty with it, or it was for most people, it's kind of like you can go through it the first time around.
What do you mean by difficulty?
Like was there difficulty matching with programs or?
Yeah, so some of my friends didn't match, and this happens in medicine too. If you don't match, then you can do something called post-match. So every residency has a certain number of seats that you can go in. So for instance, if my group was 6 seats and only 5 match to it, then there's 1 seat that's open. So you can call and there's, I think the day, I can't remember now, but I think the day of, the unmatched seats are posted somewhere, and then you can call in for post-match, like, hey, you know, I didn't match, and, you know, will you accept me? And then you do a quick interview, and if you get matched, then you go back in there, and then if not, then they'll leave it open.
That's insane. Okay, I didn't know that you could just give them a call and see if there's anything could be done.
Yeah, it's called post-match.
Oh, okay. Keep that in mind.
Okay. Yeah, go ahead. You had another question?
Oh, I was just gonna say, oh, is the residency classes, do they range like that, or mostly they're like small groups of people?
They're usually small groups of people.
They're usually small.
Yeah,
Okay.
yeah, because it's advanced, because they have to hold your hand a lot more.
Mhm.
Because you're learning advanced techniques, and I think it'll be hard for the attendings to manage a lot of complicated case if just kind of letting you roam free.
Mhm. And then I understand that residency is not required for all states, but is it starting to include more states where they're starting to say, oh, for general practice, you need at least your residency or?
Oh, that's a great question. I don't know. I know in New York that it is required.
Yeah.
I don't know what the current standing is now. I'm not sure, to be honest.
Okay, that's no
I can look
problem.
it up and I'll figure it out. But yeah, this was my path. I went through undergrad, dental school, residency, and then I became an associate at a couple practices. I think this is the most common path, and then you become an associate, and then you can either decide to stay an associate, or you can decide to own. You can decide to specialize. You can decide to be a different type of associate. So, I think there's different avenues of what kind of dentistry you want to practice. But for me, it ended up being ownership and continuing education. And, I was lucky I had a lot of mentors. These are some of my mentors right here. They're at UCLA, but I love these guys. But mentoring is like, I think, so critical and crucial to anybody's success in dentistry. Number one, for you guys as an undergrad, to get a mentor that can help you get in, and then eventually when you get in, a mentor that can help you grow as a practitioner, you grow as an individual, and these mentors will understand your struggles more than anybody else can, because they were in it for a long time before they made it somehow.
Yeah.
Okay, let's see. So I guess a little bit about general dentistry, if you didn't know already. These are like the day-to-day things we do as a general dentist. You kind of have a plethora of things in your armamentarium so that you can, do fillings and bridge work, crowns, whatever have you. So as a general dentist, a GP, you can do anything you want to a degree if you're competent in it, basically. And every dentist is competent in certain things. So some things interest other dentists. Like, let's say, I don't really particularly like, doing molar root canal. So I refer a lot of them out. But some dentists really love doing it. General dentists love doing it, and they do a lot of it. I did a lot of it when I first graduated, and I just decided, I don't really like just being in there for hours. I like to get in and out. One of my buddies says the best dentistry is quick dentistry, and for me, I just want to be hunched over for like 2-3 hours doing that. But you can, you can do whatever you want with that. And so, I mean, this is like a normal day doing a filling for me. So just like a temporary filling that somebody broke off, removing the cavity and then restoring it. And I take a lot of pictures in the office just to kind of show the value that we provide. I know a lot of offices don't do that, and I think it's really important, and the patients really, really like that. Questions so far?
Um, I had something more from the previous slide, actually.
Oh yeah.
When you were talking about being a practice owner now, how'd you decide that you wanted to, have your own practice instead of continuing as an associate?
Oh, that's a great question. I think it's a lot of turmoil in your own mind, because as an associate at a different office, you're kind of limited to what you can use, limited to what you can buy, limited to what techniques you can do because of the materials. So eventually I just wanted more autonomy and control over how I treated my patients, and not kind of be bound to either financial constraints of the office profit margin. And I'd rather try to treat the patient as best as I could. And I felt like the only way to do that was to have my own practice and have that autonomy.
And then, so as the owner of your own practice, if you have any like particular difficult cases or anything, do you try to reach out to like friends or other doctors to try to work on a case, or how does that go about?
As a solo practitioner here, I think that sometimes I bring specialists in, and I definitely have friends that come by and help me out. And if I can't handle something, I will definitely refer it out, So I have no problem referring out and knowing my limitations. But I think that, yeah, I mean, I think that's how you have to practice. You can't do everything, and
I getcha.
there's going to be somebody better doing something than you all the time. You just got to know where you're.
And then how long were you an associate before you realized that you wanted to own your own practice?
I was an associate for about 3 years.
3 years.
No, well, I knew I wanted to own my own practice, so I'll take that back. I knew I wanted to own a practice, so by year 2 and 3, I kind of felt like, okay, I'm ready to make these decisions because I was tired of being told that I couldn't do something. Not by my own limitations, but by the practice finance limitations or something.
I see. Okay.
Okay, so cosmetic dentistry, we'll just kind of touch a little bit on that because I think you're a little bit interested in that. So in cosmetic dentistry, you got to realize that you're always treating a patient, and in cosmetics, beauty is defined by the individual. So what I find beautiful may not be what you find beautiful. And so understanding that is the first part. And so that means that you have to really understand the patient and connect with the patient and understand what they want. So I think that's the biggest part of aesthetic dentistry, because if you can understand what they want, then you can deliver what they want. But if you don't understand what they want, and there's, and you're kind of pushing what you want into something, then there's that disconnect and nobody's happy, right?
Yeah.
In aesthetic dentistry, it's the communication part is most essential. So you have to communicate with the patient what shade, color, chroma, hue, whatever you want to call it, all the different things that make up the color of the tooth, right? So you have to communicate that with them. You have to communicate what kind of texture you want, the translucency, the size, the shape. How do you want the light to reflect off of it? And lastly, what as a dentist you care most about is their occlusion, their bite. Is it going to be functional? So let's say you can make it beautiful to what they want, but they can't even chew on it. They have a skeletal class 2 or a class 2, and it's like it's not going to work, or you're going to have the tooth and damage more tooth structure. So there's that biological kind of science part about it where you have to convey to them. And sometimes patients don't really like that after. Like, hey, you want all this stuff, but I got to shave down your tooth and you might need a root canal. Do you want that? And they say no, they may say yes, but that's up to the patients to decide. And that's for you to kind of delegate and tell them, hey, these are the risks. And if you accept the risk, we'll do it. If you don't, then that's up to you.
So it's kind of like almost like an educator position too, where you have to explain.
I think dentistry is all about education. Like my role is to educate the patient, and the patient gets to make the decision. I never make a decision for the patient.
So then I'm guessing that also means that you spend a lot of time with each individual patient, since you have to discuss so many things. Do you average spend an hour with each patient? How does it normally?
Well, it depends on what they want. So if their treatment goals are, if it's just like, I just want a cleaning, and they, so then that's, it's really quick. They had a cleaning like 6 months ago or 3 months ago, that's probably nothing. So 30 minutes, an hour, tops. But if it's like a full mouth reconstruction case, you have to develop time to take records. And by records, I mean take photos, take impressions. And impressions are traditional done with like the goopy stuff, like it's called it. So you need molds of their mouth. Now we can digitally make molds of them and then digitally design and craft them, but that takes time too, and it can't be done all in one go. And then you have to bring them back another time to test drive it, because again, you don't know what they want. So you can either cut the tooth and hope and be like, hey, it might be what they want, or you can test drive it for them a little bit in a temporary phase. And also you have to test drive them because their bite might not be in the correct spot, or they may not tolerate that correct bite or that new bite that you create them. So there's a lot of time and investment on the patient's end and on my end too. So it just depends on the case. If it's like 2 veneers, not a big deal. 3 or 4 veneers, not a big. If you're doing a full mouth, you have to spend a little bit more time. So again, it just depends on what they want, your desires, and how you can kind of manage that basically.
And then this is just like a personal question for myself. So if there was the case where a patient came in and they naturally have like an underbite. And or like an underbite, and then they wanted to get something reconstructed. You would have to work with their underbite, right? You wouldn't like try to fix it with the procedures that you're going to be doing or by.
Not necessarily. I think so. You're talking about something called a class 3 bite, where there's two different types. There's dental class 3, and then there's skeletal class 3. The bone is kind of like too developed, or the upper maxilla is too undeveloped. So sometimes it requires surgery, like surgical interventions, and those procedures are typically done by an oral surgeon. They're called the Lefort or a BSSO, and basically you fracture the jaw and you manipulate it in a certain way, and then you kind of seal it shut, and then you let it wait and heal by itself. So it's kind of like breaking like an arm. You put a cast on, right? So do the same thing in the mouth. You break the jaw, but you put like these caps inside, so it's plates and screws, and then they wire it shut. And then for about 6 months, and then it's in the correct spot. But usually those things require ortho intervention first, because you can't just like, where are you gonna tie it together, right? Class 3 is usually like this, then they'll straighten it out, and which usually looks worse. Then they break it, but you have orthodontic treatment so they can tie it together. And after all that, if they still don't like the shape of their teeth and the color, then maybe you have to do veneers or crowns or what have you. But I think it's multidisciplinary, and the diagnosis comes during the the evaluation. So it just depends on what their desires are, and if they're achievable or not. So sometimes they're not achievable because patients don't want to do surgery, and so you're limited by the amount of movement and the amount of space you have, essentially.
I see. And then I'm going to throw this question at you. How do you personally feel about veneers? Like, I know, especially today in like online media culture and stuff, I see it often where people are like, yes, veneers, and other people are like, no, why would you do that to your teeth? Like, yeah.
Okay. I mean, I think, like anything in dentistry, nothing lasts forever. You're in a wet oral environment with tons of bacteria. So, and it's dynamic, and you bite on stuff, and your normal teeth can break too. But with that said, veneers are an awesome option if you want to change the shade, the shape, and the direction or where your teeth are movement wise. I think it's a great option if you don't want to do like traditional ortho, or let's say traditional ortho fails to get you to where you want to be, because let's say you can't brighten it any more than it is, or let's say that it's straight but your teeth are shaped pretty ugly, so there's a lot of things. So vanity plays an important part, and everybody's desires for beauty is different. So
true. Okay.
Yeah, so it's like like breast enhancements. Some people are so voodoo, you can't do that. But if it makes you feel more confident and it brings you that quality of life, why not? So same with your teeth, right? So irreversible, obviously, and you will have to maintain it, much like anything else in your mouth. But it can last a very long time, and if you take care of it and you understand the risks, then I think it helps out, and it's a really good treatment to provide for patients.
And then, do you happen to see children? I know you're a general practice, so do you happen to see children anytime, or is your patient population more targeted towards older people?
That's a great question. I don't have a limit to my age group that I see. I see anybody from 6 months, 100 years old. I think my oldest patient was like 103 or something.
Like that's crazy. Oh my God.
So everybody has different needs, and I don't limit my practice to that. And it's just, if they want to have a great experience, they'll come see me.
And then speaking about the topic of kids or even like older patients, how do you personally deal with someone that's like super afraid of going to the dentist, or they have extreme dental fear and anxiety?
Okay, well, there's a couple ways. One, you can knock them out.
Simple.
Nothing to be afraid if you don't see anything. I mean, yeah. So I mean, to be real, like sedation is always an option, and there's a spectrum of what kind of sedation you want, right? So there's nitrous oxide, also called laughing gas, which is pretty routine for kids, to kind of relax them a little bit. We use them in adults as well. Then you can kind of push it a little bit more by doing oral sedation. Push it a little bit more than that and do IV sedation. And IV sedation, where you have an IV in your arm and you can kind of, they call it twilight sleep. So you'll be in and out, but a lot of times you don't remember anything. Then there's more deep sedation where you're kind of like non-responsive until you have painful stimuli, but you're still there. And then full general anesthesia where you're intubated and you get worked on like that too. So it depends on the level of anxiety and the medical need for it. But yeah, I've had patients where they're intubated, like when I was in the residency, and we had to extract teeth on them, and they're saying patients that are just need basic cleaning, but they're so anxious, so to be sedated. So
what's the?
I was like, it just depends.
Oh yeah. What's the extent of sedation that you do at your practice?
We go up to IV sedation so far. I haven't had a GA case yet, but not saying that I'm limiting myself to that. But we do IV sedation. That's the furthest sedation we have so far.
Okay.
Good questions.
Thank you.
All right. So I guess moving on a little bit, digital workflow. This is something I'm super proud of and still in the beta phase of it. We do a lot of optical scanning. So instead of using that goopy stuff anymore, we have these little, they're called iTero scanners. So it's an optical 3D scanner.
That's so cool. Oh my God.
Yeah, so we're able to scan and then digitize it and then kind of superimpose that on a normal face picture and then kind of do your smile design that way, or just do normal, bread and butter, crown and bridge, onlays, inlays, work like that. So.
So instead of, you don't need to use alginate if you have this equipment?
Yeah, you need to use it. I don't. Yeah.
Oh, seriously? Oh my God.
It's been a while since we actually used alginate. I think it's been a couple weeks now. But they're uses for alginate still. But for the most part, no, it's not necessary. Yeah.
So then, if you wanted to like build a crown or anything, you would send the scan to the lab, or?
Yeah, it's really neat. So you can do a pre-scan, which is nice because you can kind of get where your occlusion is, and so you don't change that. And then you do a prep scan. So you prep the teeth and then you scan that. And then basically now you have an inner and outside of the crown, and I email it to the lab instead of like analoging, having somebody there, pouring it up, all this stuff. And so you email it to them and they're able to get the crown back. If you use a local lab, in like less than a week sometimes.
I know, because the normal wait time is normally like 2 weeks or something.
Yeah, so we can get it in like a week or less sometimes now.
That's so convenient.
So convenient. I love it. But it costs a hefty chunk.
I figured.
And that's why a lot of practices don't have it, right? Because they don't want to invest in it. And so I'm all about technology and convenience and to make sure that we can maximize efficiency. So yeah, I'm all about this technology.
It sounds cool.
It's super cool. All right. So typical day at the office. This is my staff, and what we typically do is just routine stuff: exams, X-rays, cleaning. The most meat of the practice is basically bread and butter dentistry. Occasionally you get like a super cool case. Like the other day we had a 12-unit crown case, so that was like a smile makeover. Sometimes you get like 4 veneers in the front, but those are hit or miss. But the majority of people just want basic dentistry or need basic dentistry, just normal maintenance on your teeth, either from gum health or your cavities or what have you. So that's just the normal day. And like I said before, Monday through Thursday, 9 to 5, and then some Saturdays, like a half day on Saturday, just to get the weekend open a little bit.
Are you the sole dentist at your practice?
I am the sole dentist right now. We are expanding fast, and hopefully in the near future, we'll be able to have another associate.
And then just a quick question that popped up. When you first opened up your practice, how did you find ways to like advertise yourself or get your name out there?
Oh, I'm still struggling with that. So I don't think for advertising or marketing, they'll tell you in marketing, nobody knows the proper way for market because every market is different, and you just throw stuff at the market and see what sticks. So for me right now, I think it's just I've been relying on just asking for reviews. And like, if you had a great I'll just say, hey, if you had a great experience today, you get an automated message around 5:30, please leave us a review. And then sometimes they leave us a review, and it kind of slowly builds on that. It's like this world of social proof is what we live in right now. So the more reviews you get, the more people trust, and then the more they come in. So it's kind of snowballing like that.
Building rapport. I see. Okay.
But yeah, this is a typical day. I won't read it to you because I mean, I'm pretty sure you guys, if you're shadowing somebody, you'll see everything that we do here. But yeah, that's the normal typical day. Normal ceramics, like I was telling you before, just doing fillings or crowns. That's like the normal workflow. We do dentures too. You know, it's not very glamorous, but you know, they're needed. Some people can't afford certain things, and I think it's still a great way to, you know, have some kind of chewing efficiency back. It may be like close to 30, but something's better than nothing, and you can always upgrade later, which I tell my patients. So.
Out of curiosity, do you also perform like implant surgeries in your practice too, or?
We do full mouth implants, which are traditionally called the all-on-X, all-on-6, all-on-4. Do single unit cases, like this case right here is a single unit. Yeah, into denture stabilization. So yeah, I mean that's I wouldn't say a big chunk of my practice right now, but yeah, we definitely do that. So it just depends on where your area, your location is, and the need of the public for it.
Okay.
Let's see what else. And advice, I guess I'm getting toward the end of my presentation, but advice for you guys is just shadow, kind of get more experience, see if you really, really love dentistry. It's a huge commitment of time and money. It's only getting more expensive. Yeah, so make sure you really love it, because I mean, there's been some people in my class that got in and they had a career change, you know, and it's very unfortunate because by the time you get out, you're like $500,000 debt, you know.
Yeah, I think like that's one of the scariest parts for me personally when I think about that. Like, wow, I'm going to be in so much debt. And then also I was thinking, like, if I want to open my own practice, that's also so much more debt too. So yeah,
it's a lot of debt. Yeah, I'm not going to lie, but you know, you're going to be in it with other healthcare professionals too, and you're going to be in the same spot with, you know, it's scary right now because I don't know, in your group of friends, you may not have people with that much debt, but it almost becomes the norm because all my friends that are dentists have these debts too, and it's just part of life, you know. So there's good debt and bad debt, what you find out later on in life. And
correct.
School stuff is good debt, you know. Usually it's a low percentage. Usually the banks will still loan you stuff, so it's not a big deal. And hopefully you can leverage your debt with, you know, the income potential that you get later on. So, you know, all in all, it might be big debt, but you're still going to be doing okay. I've never met a poor dentist.
That's very reassuring.
Yeah. And the default rate for a dentist, you know, is less than 1%. So banks are willing to loan it to you because you're really low risk at that point. So even right now with the high debt, like the load right now, I think it's still feasible to become a dentist. You know, I don't know what it'll look like in the next couple years, but I think it's still a great career, a great outlook. And I would not be concerned about debt because everybody has debt. I mean, look at the US, how much debt are we in? And it's nothing, we just print more money. So it's okay.
True. And then looking at your slide right now, I see prepare for the DAT. Do you have, what resources did you use? Any tips to really prepare for it that you used?
Shoot, way back in the day.
I know.
I did Kaplan, so I felt that was very helpful. I liked Kaplan for the PAT section because it kind of trained your mind to kind of see, like, or just kind of to look at like what they see, you know, and get quicker at it. But
do you remember how much time you spent studying for it, roughly?
I don't remember. I took a course. I just know I took a course and I studied. I don't feel like I studied that much. Yeah, I spent a summer studying before my DAT. That's what I remember. Like actually really studying like the summer before.
Yeah, that's probably the hardest part for me because you have to study for such a long time to like really reinforce this skill. So yeah, consistency, I guess, right?
True. And like in dental school too, you will use those learning skills too, because I mean we pulled all-nighters with my group. Like we went to like 2 in the morning, 3 in the morning, 4 in the morning sometimes. When woke up after, or sometimes pulled an all-nighter and then took the test and then went home and just crashed. That was the norm. Everybody did it. So you didn't feel like, oh, this sucks. I'm the only one doing it. All your classmates are doing the exact same thing. They're all struggling and you struggle together. And I think that's why the class was so close to each other. Like we created this bond, but you'll have that same interaction with your colleagues later on too. Like they all have their own stories about how they struggle. But then the grass is greener on the other side. And the hardest part is to get into dental school, in my opinion. Dental school was pretty. I mean, you learn a lot, but it's stuff you want to learn about, right? You'll use a lot, but getting into it is the hardest part, in my opinion.
Okay, and then so I'm personally writing my personal statement right now, and one of the big questions is, what was your aha moment, or like, was there like a specific moment where you were like, yeah, this is what I want to do, or like I remember you said in the beginning it was kind of like a gradual thing that you realized.
Yeah, I think it was a gradual thing. I always say I go the path of least resistance, and that was kind of like, okay, this might work out, and okay, I think that might be okay. Let me try this. And he was my friend, so I was like, okay, I'll try it, and it just got to it, and I was very lucky and fortunate. That doesn't happen for everybody, and I recognize that. But no, there was no real big aha moment. I just saw an opportunity, and I think that's life. You have opportunities, and you have to seize it, and sometimes it doesn't work out, which is okay, but sometimes it does, and then it's awesome.
And so for your personal statement, did you I don't know if you remember, but do you happen to remember if you wrote about a specific moment, or did you explain like it was like a cumulative thing that kind of built up and made you realize?
I remember. I explained how it was cumulative, but I also I think my my big word, I can't remember how I worded it, but I talked about opportunity, and opportunity in my family. I was the first generation of my family to go to college.
Oh, wow. Congratulations.
Thanks. It's way behind, but yeah. So I was the first in my family to do that. But I talked about opportunity because my parents were boat people. So during the Vietnam War, they didn't have an opportunity for education because the Communist Party would, block you from knowing certain things, much like what's going on in China right now. I won't get into politics, but
yeah,
my parents had that, they didn't have the opportunity to learn. So when they moved here, they didn't have the opportunity to do certain things because of their income. They had nothing. They didn't learn English. They didn't speak English. So that opportunity wasn't there for them. And they were always trying to create an opportunity for me to grow, to learn, to do good in school so that I could have a better future. And so having these certain opportunities here and there gave me that avenue. And so I think that's my approach to it. And it stemmed from love for my grandma. Because she didn't have the opportunity, but she always wanted us to have that opportunity. And that's why they immigrated here. They risked their life to go on the boat. And so I think that's where I draw my strengths from. And that's where I kind of drew where this all came from.
I need to think of stuff like that too.
I mean, you just draw from your life. I'm sure you have these similar experiences. A lot of people have these, experiences. It's not like an aha moment, but it's like a moment where you feel like you get strength and why you want to do it. There's a why, right? Is it to help people? There's a lot of things.
Okay. And then some other questions I have is, you mentioned you play bass and stuff.
Yeah.
How did you find time to still explore your hobbies and stuff, both in dental school and both out?
Oh, that's funny. Well, I mean, I played bass in high school. We were in this screamo band. I still jam with them like at least once a month.
Oh my god.
In dental school, I was in a dental school band. We were called the Matrix Band. So I don't know if you know what a Matrix Band is, but yeah, it's for like class 2 respirators. Anyway, we were called the Matrix Band, so we played in that.
That's so funny.
Shout out to the Matrix Band. But link down below. No. So I just play, and it's a hobby. I play at home, play the guitar at home, and it's just one of my creative outlets, I guess. I think dentistry is like that for me too, having a creative outlet. And being able to sculpt, let's say just a filling or design smiles is another creative outlet that I like. And my practice is called artsy dental because I love how artsy dentistry is. I call it that. But yeah, you find time for your hobbies, and dentistry is not my life. It's a big part of my life, and I enjoy it very much. But there's other things in life that's important too, right? Their family, music, for whatever.
Okay. And then, do you have a least favorite part about dental school?
Least favorite part. I don't know. I think
You
for
liked
me,
all of it?
I didn't like least favorite part. Well, I'll leave it on a positive note where.
Okay, so most favorite.
Well, but least I dislike not having to see my dental school friends as often anymore. How about that? Because, like I said before, once you get out there, you're kind of like on your own.
Yeah.
And once you're in school, you had this camaraderie, and that's why I still teach, because of that camaraderie. And I always remind my students, like, don't forget this part, like have fun with your classmates too. Like, it's not all about studying, but I miss that. But the worst part of dental school, I don't think I hated pouring all nighters, but I think back on it, I'm like, that's pretty fun. I probably can't do it anymore, but at least I had all nighters with my friends.
I do that now too. Like,
yeah, it's fun. Like, you think it sucks, but when you get out there, you're like in the real world and you're working every day. I'm like, oh, I miss that. I can't do it anymore. Like, it would suck. Like, I probably would not be awake the next day and be all groggy. But life.
And then, do you have a favorite procedure right now?
Favorite procedure? I'm really enjoying aesthetic dentistry and smile design right now. It's not so much a procedure, it's just like that whole digital aspect of sculpting it. Before, you would have to do something called a wax up, and we still do wax ups, traditional, but a wax up is having a mold model and then applying wax and carving it away, and then using that as a template or a mold for the new design. But now we can do something called a digital wax up. So I don't have to carve it anymore, and I can use the computer and drag certain things to make shapes here and there, create valleys, and then so I think that's really cool.
It blows my mind how fast technology works.
Like, it's
both in dentistry and
I'm still learning it. I'm still trying to implement it to its fullest capabilities right now, but that's something I'm really, really having fun with. But I enjoy like the normal, extraction too. Those are fun. Getting some blood, I think, tickles your fancy. It scratches that little tickle a little bit. Yeah, I did an extraction. I saw some blood. I tied a suit. Good.
Bing bang.
But, yeah, we're good there. But no, there's so many things. I think I'm a little ADD, so I get to dabble in a little bit of everything, which is kind of nice. Once you get bored of something, there's always something new. So.
And then a question about dental school. So I know that's like an important time in people's lives. Like, they get married, they have families, kids. Did you see that a lot in dental school? How did you navigate through that yourself? I know you have a girlfriend that you've known for a really long time. So your personal experiences.
Yeah, relationships. That's a huge part of it, because you're juggling your professional career. And you're juggling your personal life. And I did a long distance relationship for 4 years of dental school. I know some of my friends and colleagues did too. But some of them had babies while in dental school, and they managed having a baby and doing well in school. So I can't complain. It's manageable. If somebody can have a baby, 2 babies at that in dental school, and still make it out on top, like, hey, anything is possible. So having a girlfriend, boyfriend, getting married is not a big deal.
Okay.
You're like I said before, dentistry is not your life. You still have one, but dentistry is a big part of it.
I see. Okay. And then, I think that's all the questions I have for her now. Do you have any more slides or anything here?
I think that's it.
Okay.
Feel free to reach out to me. I know sometimes it can be a little scary to reach out to a dentist. I know when I was your age, like, I felt like, there's just so far above, like I couldn't really talk to them when I was scared. But I think in the days of social media, it's really easy to just send a DM But feel free to DM me. I'm happy to mentor and like talk to you and kind of coach you through things. And if I don't know the answer, then I'm sure like I have a friend that will. Yeah.
All right. So I guess that concludes the end of your presentation and the end of this session. Thank you so much, Dr. Nguyen, for your time and your presentation. It was so fun talking to you. And you just have such a charisma that really brings me in and focusing on everything. So yeah, thank you for your time.
Thanks for
And then
having
thank you for
me.
everyone watching. And I hope everyone found this session enjoyable and informative. And good night or good afternoon to everyone who's watching.
Happy holidays.
Yes, happy holidays. All right, thank you.
Bye.